so the first one that we have, we'll be discussing about the types of joints. So what are the types of joints? So remember that the types of joints are fibrous joints, then we have the cartilaginous joints, fibrous, cartilaginous and the synovial joints. Now these joints are also called as, remember it is SAD, okay. So from fibrous, cartilaginous, synovial, SAD stands for, it is synarthrosis, amphiarthrosis or diarthrosis, okay. Synarthrosis, amphiarthrosis or diarthrosis. Synarthrosis, fibrous joints basically have no movement. In the cartilaginous joints, we have two types of cartilaginous joints, the primary cartilaginous joints and the secondary cartilaginous joints. The primary cartilaginous joints, cartilage is chondro, so it is also called as Synchondrosis, okay, it is Synchondrosis, while the secondary cartilage joint is called as symphysis. So in Synchondrosis, syn again means like it's a fused joint, so that means there is no movement here. These are the temporary joints that we have. For example, the joint at the growth plate, right? So this gets calcified and then there is no movement there. Symphysis are the joints in the midline, like we have the pubic symphysis, right? The intervertebral joints, the pubic symphysis. Then in the sternum, the joint between the manubrium and the body, the manubriosternal joint, the xiphisternal joint, right? The manubriosternal joint and the xiphisternal joint. These are basically, these are the symphysis. Now, in the synovial diarthrosis means they have good range of movement, and all the joints that we have, the rest of the joints, the hinge joint, ellipsoid, condylar, right, the ball and socket, all of those are synovial joints, right. So we should know that in the fibrous joints, what else do we have that comes under the fibrous joints? Basically where there is no movement. So we have sutures, we have syndesmosis and we have gomphosis. Sutures, syndesmosis and gomphosis. Syndesmosis is where the two bones are basically fused by a ligament, right, like the interosseous membrane that we have between the radius and the ulna, right, the middle radioulnar joint, that is a syndesmosis. This is one of the recently asked questions in FMGE exam, right. Gomphosis, remember the gums, that is related to the teeth. So gomphosis is basically related to the teeth and uska socket wala joint, that is a gomphosis. And in sutures, you should remember that one exceptional important example. What is that important example here? Remember Schindylesis. Okay, remember Schindylesis is a type of suture, that means it's a fibrous joint. It is present in between which bones? It is present in between Vomer and Sphenoid. Okay, it is present in between Vomer and Sphenoid. Okay, we'll be seeing all of this. So these are the various types of joints that we have here. Now coming to in the upper limb, what joint is an example of what joint, right? So the first one that we have here, that is the shoulder joint. Okay, so the shoulder joint, we know that it's the ball and socket type of joint. The shoulder joint is a ball and socket type of joint. Coming to the next joint, basically going from the elbow till these joints here, the interphalangeal joints. So remember that the mnemonic here is a palindrome, that means H-E-E-H. What is a palindrome? Is a word that can be read the same if you read it straight in the forward direction or in the backward direction. So remember, it is H-E-E-H. Very important to remember here, right? That's an important trick to remember. So remember, it is H-E-E-H. Okay. So in H-E-E-H, what are the joints here? So starting from the first one, that is the elbow joint. Okay, so what comes after the elbow is this joint, that is the wrist joint. What comes after the wrist is this joint, the knuckle joints, that is the metacarpophalangeal joints. Okay, the metacarpophalangeal joints. And then comes this one, which is the interphalangeal joints. Okay, the interphalangeal joints. So elbow joint, H-E-E-H, H. The H stands for the hinge joint. The E stands for the ellipsoid joint. Right. So, if we see here, elbow is hinge, wrist is ellipsoid, MCP is ellipsoid, IP is hinge. So, remember HEEH is your trick to remember there. Right. So, these are the joints in the upper limb. If I add two more here, the sternoclavicular joint and the acromioclavicular joint. Sternoclavicular and acromioclavicular. So, the sternoclavicular joint, that is SC, sternoclavicular SC is a saddle joint. We will be seeing the trick for saddle joint ahead. Acromioclavicular joint is a plane joint. Okay, remember acromioclavicular joint is a plane joint. A for acromioclavicular, A for aeroplane, and it's a plane joint. Okay, so remember that this is a plane joint. Okay, this is a plane joint, right? This is what you need to remember. And remember the other trick that we have learned here. This is very, very important in the upper limb. This helps you remember the four joints. That is the HEEH. Okay, that is the HEEH. Now, going to the joints in the lower limb, right? So, the hip joint, again we all know, is ball and socket type of joint. Okay, the hip joint is a ball and socket type of joint. Then you have the next one, that is the knee joint, right? In the knee we talk about the condyles. So, remember that this is a condylar or condyloid joint. And what is the other example of the condyloid or the condylar joint? Where else do you have the condyle? The mandible condyle. So, remember the temporomandibular joint. Okay, we talk about the mandible ke condyles. So, that is the temporomandibular joint. This is condylar. Now, going to the next one, the tibia and the fibula. Okay, the tibiofibular joint. The superior tibiofibular joint and the inferior tibiofibular joint. The superior tibiofibular joint, P for it's a plane type of joint. The inferior tibiofibular joint, F for it's a fibrous joint. Okay, it's a fibrous joint. Syndesmosis, right? It's a fibrous joint. Syndesmosis. Okay. And the next we have coming up in the line is the ankle joint. Ankle joint is a hinge joint. Hinge joint like similar to elbow. Okay, that's a hinge joint like the elbow, right? So, these are the joints in the lower limb that we should know, right? The pubic symphysis, we have seen that pubic symphysis in the midline. This is a secondary cartilaginous joint, has been asked in the FMGE exam many times. Okay, this has been asked in the FMGE exam with the X-ray image many times. So, this is important. Okay. Now, going to the joints in the thorax, right? So, the joints in the thorax, first if we talk about the midline joints, so we know that the midline joints are symphysis. So, what are the midline joints that we have here in the thorax? So, we have the manubriosternal joint, the xiphisternal joint, that is in the front, right? That is in the front, manubriosternal, xiphisternal. What do we have behind? That is the intervertebral joints. Okay, even they are symphysis. Okay, that is symphysis. The next one, the majority of the joints in the thorax, you will see the plain synovial joints. So, the articulation of the ribs with the sternum, that is the sternocostal joint, the ribs articulating with the sternum, the ribs going and articulating with the vertebra. These are the plain synovial joints. This is your previous year question of NEET PG. Okay. So, very important. This is your PYQ for NEET PG. So, you should remember this. So, remember that what is the example here? So, this one here, this is the sternocostal. Okay, this is sternocostal. And what is this one? The costotransverse, because it articulates with the transverse process of the vertebra. Okay, so this is the plain synovial joint. Okay, that's a plain synovial joint. Now, next one that you have, the CCC. Okay, the CC joint, that is the costochondral joint. Okay, the costochondral joint is a cartilaginous joint. That means it's a primary cartilaginous joint. So, the costo, the ribs and articulating with the cartilage, right? So the costochondral joint CCC is what you should remember here. The costochondral joint is a cartilaginous joint, that is the primary cartilaginous joint, that is CCC. Okay, remember CCC. So majority of the joints here, you have the plain synovial joints, you have the symphysis, and you have the primary cartilaginous joint there. Okay. So now coming to the mnemonic for the saddle joint. Okay. So for the saddle joint, we start with the 3 letters. So CMC. Okay, remember that CMC, the first carpo-metacarpal joint is saddle joint, right? Now what we have next, we start removing the alphabets. So I remove M out of this. This becomes your CC joint. What does the CC joint stand for? The calcaneocuboid joint. Okay, it's the calcaneocuboid joint. Now the next alphabet I remove is the C. So remember that if I remove C and replace it with S, so this becomes your SC. So the sternoclavicular joint. Okay, the sternoclavicular joint. This is a saddle joint. The CMC stands for carpo-metacarpal joint. Okay, so remember that CMC, remove the MCC, remove the CSC. Okay, so these are your saddle joints. Okay, this is the mnemonic for your saddle joint. Okay, clear with everyone? The next that we have is saddle joint is SAD. Okay, so SAD event. What is a SAD event? Anybody getting a MI, myocardial infarct, is a SAD event. So MI, that means the joint between the malleus and the incus in the ear ossicles. This is a saddle joint. Okay, it's a saddle joint. So remember that MI is a SAD event. This is your trick to remember here. MI is a SAD event, and the CMC, the CC and the SC, this is your trick to remember the other saddle joints. Okay. For ball and socket joints, the trick to remember the ball and socket joints is this. Okay, so remember that THIS, that is T for TCN, the talocalcaneonavicular joint is a ball and socket joint. The hip joint is a ball and socket joint. The shoulder joint is a ball and socket joint. The I and S help you to remember the joint between the incus and the stapes, that is a ball and socket. So ear ossicles, malleus, incus, stapes, MI, SAD, saddle, IS, this is ball and socket. Okay, so this is your trick to remember the ball and socket joint. Okay, this is your trick to remember the ball and socket joint. Okay. So now coming to the summary of the types of joints. So we have fibrous joints, cartilaginous joints and the synovial joints. Fibrous joints are also called as synarthrosis. We have sutures, we have syndesmosis and we have gomphosis. The special type here is the Schindylesis. In the cartilaginous joints, we have primary and secondary. Primary are called as Synchondrosis. Right, primary is called as Synchondrosis. We saw the example of the growth plate, that is the joint between the epiphysis and the diaphysis, that is basically your Synchondrosis. The next one, the CCC, is what we saw, that is your Synchondrosis, the costochondral joint. Secondary cartilaginous joints are the midline joints like pubic symphysis. For ball and socket joint, we saw the mnemonic, that is this is a ball and socket joint, right? This is a ball and socket joint. The talocalcaneonavicular, hip, shoulder, we know this is incudostapedial joint. Okay, the incudostapedial joint, this is ball and socket. For saddle joint, it is for saddle joint SC, CC, CMC, right? The CMC, SC, CC is what we have seen. These are the saddle joints plus MI is a SAD event. Okay, so remember that MI, the joint between the malleus and incus, is also saddle. What is SC? The sternoclavicular joint. Okay, what is SC? The sternoclavicular joint, the calcaneocuboid joint and the first carpo-metacarpal joint. First carpometacarpal joint is involved in which arthritis? Remember, osteoarthritis. Okay, so if you have a patient with a pain here, think of osteoarthritis. Elbow, wrist, MCP and IP. We have seen the mnemonic for this. What was the mnemonic for this? That was a palindrome. Okay, that was a palindrome. So what was the palindrome here? H-E-E-H, right? That was H-E-E-H. In the ossicles, malleus incus, MI is sad, and this is your ball and socket joint. Okay, that's your ball and socket joint. Radioulnar joints. Okay, talking about the radioulnar joints, the superior and the inferior. So remember that the rotational movement, the pronation and supination takes place at the superior inferior radioulnar joints. Wherever there is rotational movement, those are the pivot joints, also called as the trochoid joint. So remember that the superior and inferior is a pivot joint. The middle one is where the radius and ulna is fused by that interosseous membrane. So that is a syndesmosis. That means it's a fibrous joint. Okay, it's a fibrous joint. For tibiofibular, the P for plane, superior is plane, inferior is fibrous. Okay, superior is plane, inferior is fibrous. Atlanto-occipital joint, what movement do we do here? Occiput and atlas. Remember, that is the yes movement. The atlantoaxial is the no movement. How do you remember this is? So remember that when I say atlantoaxial, axial is the x, x means no. Okay, axial is the x and x means no. So it is the atlantoaxial one where you have the no movement. Okay, so when it's a no movement, it's a rotational movement, and that is why this is going to be what kind of joint? A pivot joint. Okay, so rotational movement, this is a pivot joint. At atlanto-occipital, it is yes. So what kind of joint is going to be this yes wala? Yes is ES, that means remember this is ellipsoid joint. Okay, this is ellipsoid joint. So if we talk about the joints here in the skull, right? So if we talk about the joints in the skull, let me write it down here. So what do we have in the skull basically is, so starting with the first, the vomer, okay, the articulation of vomer with sphenoid, then the sphenoid with the occipital bone, and then the occipital bone articulating with the atlas, and the atlas articulating with axis. So the first one that you have here, vomer and sphenoid, this is a fibrous joint, right? Schindylesis, this is a fibrous joint. Sphenoid and occiput, right? Remember that is SOC. So remember it is SOC, socks ka S. This is a cartilaginous joint, that is synchondrosis. Okay, this is synchondrosis. Occiput and atlas, the yes movement, this is the ellipsoid joint. Atlas and axis is a no movement, this is a pivot joint. Okay, this is a pivot joint. So remember, these are the various joints that we have. Look at the image based questions asked previously. This is the middle radioulnar joint, joined by the interosseous membrane. This is syndesmosis, that is a type of fibrous joint. Superior and inferior, these are the pivot joint. This has been asked in the FMGE exam, like I mentioned many times. This is the pubic symphysis. So an arrow marked on this, and the question is, what kind of joint is this? This is the secondary cartilaginous joint. That means it's a symphysis, pubic symphysis in the midline. These are secondary cartilaginous joints. What do the secondary cartilaginous joints have in their cartilage? It is a fibrocartilage, which does not calcify here, and there is some movement that is allowed here. Okay, it is some movement which is allowed here. So remember that it's a fibrocartilage here, right? So yes, that was about the types of joints. I hope this is easy now. Again, do make your one-page notes, solve the questions, and just highlight in that one-page notes so that at the end you can revise it one day before the exam. Thank you so much.